Jubbs body flora, life colloidal bioterrain, and a true healing therapeutic. Dr. David Jubbs. Section 3. Healing chronic condition. Inflammation, neoplasm, and blood. A spore and bacteria is generated spontaneously from protoplasm fermenting. As a cell other than kept its integrity, its cytoplasm can have changed into spore, life colloid. A spore, virus, is the result of an other than vital self that is equal to an acid terrain. True healing therapeutics involves one having changed one's ways. Otherwise, antigen-antibody production takes place. And where there was new toxin, there was also body inflammation. Strange sugar, protein, and fat from denatured, non-life food can have been a primary cause of that condition. Protein from immune modulation of inflammation is called globulin. Globulin being raised causes other vital protein to be reduced in the plasma. Albumin is a supertransporter, and this vital protein is what is reduced during body inflammation. A neoplastic cell is the result of a red blood erythrocyte having fermented under a pathological condition. Inflammation that ran unchecked for more than 3 days is more than just a minor condition. Strange undigestible protein from new toxin and mycotoxin, dysbiotic life colloidal excrement, can have created an acid terrain. In that case, a red blood corpuscle colloid can have become a neoplastic cell. Inflammation is blood congestion in a body place under stress. That inflammation can have included swelling, redness, discomfort, heat, and physiological dysfunction. A colloid aggregates, fuses, and differentiates from having been an extrusion of an erythrocyte into wound, healing, connective tissue, and repair cell. A wound heals in an excellent way as one's blood is kept clean. A liver and spleen cell are both aggregated colloid, fused and differentiated, that originated as a red blood cell. A body can have wasted, yet the liver and spleen can have become several times what is normal. Those organs became enlarged as a result of colloid having aggregated, fused, and differentiated from a red blood cell in a pathological terrain. Blood can have been other than flowing, resulting in a red blood cell differentiated into a body cell, and that material can have been carried by the blood and became stagnant in the liver and spleen. Extraneous protein in the blood from new toxin consumed wreaks havoc on one's body system. Blood formation having other than occurred in the intestinal mucosa, the body can have developed anemia. Life food nutritional fasting, Jubbs cell rejuvenation, and calorie restriction can assist heal. Body tissue reverse differentiates into a blood cell as there would have been loss of gas transportation. Excessive living and eating initiates blood cells to other than be floating properly in the liver, thyroid, spleen, lymph, and other organs. A neoplasm can have formed under the influence of an acid body terrain. A red blood cell extravasated in the organs mentioned above can have differentiated into neoplastic cell growth or cell hypertrophy of an organ. Acid-alkaline balance and neoplasm. Cell surface pH regulates cell proliferation. Abnormal acid production causes malignant cells to have reduced sensitivity to local acid concentration than that of healthy cells. Lack of oxygen, hypoxia, and local acid concentration of a cell is linked through cause and effect. Carcinogenesis and progression of neoplasm has a lot to do with pH. pH and normal oxygen metabolism are inextricably linked. As oxygen level in tissue is only 65% or less of what it should be over 2 days, normal cells can have switched to neoplastic cells. People who have neoplasm have a blood oxygen level that is quite low. Cytotoxic therapies, chemo, surgery, and radiation reduce oxygen in the body drastically. As human beings age, calcium phosphate deposit in soft tissue doubles every 3 years. A couple hundred industrial chemicals can be found in umbilical cord blood of developing babies. Insecticide, pesticide, beauty product ingredient, petroleum, coal, tar, urban and industrial waste contaminant, and plasticizer have been found in umbilical cord blood. Pesticide, insecticide, heavy metal, plasticizer, solvent, and dioxin can persist for years and years and have accumulated in the food chain. These toxins are acids or create an over-acid body condition. Acid body cells and tissue have oxygen drastically reduced. Body available oxygen is highest where tissues are alkaline. A healthy cell in a more alkaline environment has sugar and oxygen metabolized efficiently with little waste. Yet with acidic toxin present, a cell membrane allows sugar to enter while oxygen is shut out. Ion channels that allow potassium to enter the cell also allow glucose to enter. A neoplastic cell has very little magnesium, calcium, and sodium ions in relationship to healthy cells. These ions assist oxygen to enter a healthy cell. Yet a neoplastic cell, as indicated above, only allows potassium in, so glucose can still enter. As glucose entered a neoplastic cell without oxygen, the cell gets its energy through fermentation rather than oxidative metabolism. Neoplastic cells use fermentation and produce lactic acid as waste. That lactic acid waste further increases cell membrane function. A healthy cell can only control its pH with oxygen present. Cellular DNA and RNA synthesis functions abnormally. In an over-acid terrain, blood cells accumulate in the neoplastic region and differentiate into neoplastic cell and tissue. A neoplastic cell is other than all the same. Some neoplastic cells require oxygen and can have been actively recruiting blood vessels. Yet the common denominator in all neoplastic condition is a lack of electrical conductivity, loss of pH, and reduced antioxidant of the body's bioterrain. A cell's ability to manage its pH occurs as oxygen remains. Otherwise, it becomes challenged by acid. Cells that convert sugar through fermentation, as indicated above, produce lactic acid that lowers cellular pH. As the bioterrain becomes more acidic, all disease is born in the body, including neoplasm. The greatest alkalizing element on the periodic chart is cesium, rubidium, and potassium. As the body has enough zinc, organic sulfur, and vitamin E and D whole food complex, powerful alkalizing element enter neoplastic cells through potassium ion channels. A neoplastic cell pH is raised and apoptosis, natural programmed cellular death, occurs. Factors creating neoplastic disease. Neoplastic cells occur in a normal person, yet one's immune system clears these abnormal cells away. Pancreatin at night is released, assisting the body's immune system to clear neoplasm. However, the immune system can have other than remained vital because of 1. Toxin from dead food consumption that robs body nutrient, including the body's reserves of magnesium, calcium, potassium, selenium, and vitamin E and C. Silent inflammation because of nano-life colloidal spore depositing calcium phosphate and oxalate in soft body tissue. Exposure to mutagenic force including electromagnetic smog, radiation, strange xenoestrogen, and urban and industrial chemical. Unmanaged stress and eustress, having too much of a good time, produces the immune suppressant cortisone. Parasite and mycotoxin waste. One's first line of defense is having adequate hydrochloric acid of the upper stomach. This ensures that only acidophilus survive. Starch robs the chloride molecule from the plasma, reducing the stomach's ability to produce hydrochloric acid. Aging glycalization of mitochondria and coagulation of the colloidal systems of the body. Aging causes a diminished ability to faithfully produce protein, enzymes, and antibodies, increasing neoplasm infection. Healing neoplasm with alkali therapy. Alkalinity and cell oxygen use for energy in most cases is inextricably linked. In acid bioterrain, aggressive neoplastic cells generally use sugar much more rapidly than normal cells. Parts of the world that has the highest concentration of alkali element, potassium, rubidium, and cesium, in soil and water have a low incidence of neoplasm. Strong alkaline element, especially cesium, can easily enter a neoplastic cell's membrane potassium ion channel and cause the pH of that cell to be raised. A neoplastic cell is cleared through this method. Life food nutritional fasting increases liver function to assist the body with detoxification. Vital body cells have a cell membrane electrical valence that keeps highly alkaline element out. As neoplastic cells are necrosed, blood uric acid can have risen. Jubbs cell rejuvenation applies various formula to assist the body to neutralize uric acid levels, Wildzymes and Vitex. Clathration, Usnea and Juniper formula, assist to clear electrical resistance from soft tissue and body cell. Chelation applies organic earth and plant-based materials, alpha and omega. Unique negative surface area energetics naturally pulls heavy metal, plastic, solvent, extraneous gas, and toxic volatile chemical from the blood and assists to sweep this debris out through the intestinal tract. Neoplastic cells envelop themselves in a thick fibrin covering that can be up to 20 times thicker than that found in normal cells. Immune cells can only get in to clear them up, as that fibrin covering is dissolved. Enzyme in Wildzyme assists the body to increase its organ generative reserve and overall assist break the fibrous covering that can have surrounded neoplastic cells, enabling immune cell process to assist in their process. Clearing neoplastic condition requires 1. Life food nutritionally fast and ingest marine mineral, Super C, niacin, blood and lymph formula, and 2 to 1 grams of cesium chloride 2 times per day. Cesium and rubidium from marine mineral is absorbed by neoplastic cells due to their similarity to potassium ions. Clathration and chelation formulas are applied along with Wildzyme. Wildzyme has enzymes that assist to clear avital tissue from the body's inflammatory response, as well as its rapid cell wall repair response that can have got stuck in high gear. Fibrolytic tissue around neoplastic cells can have contributed to a greater acidic environment. Inflammatory response that was without being cleared away also can have induced more of an acid environment. Immune dysfunction can have healed, as powerful fibrinolytic enzyme are used to clear immune complex up from having clogged body systems. Proteolytic, fibrinolytic, and anti-edemic processes in the body are integral to alkalizing the body from inflammatory condition. Exudative reduction of inflammatory immune response is important in reducing overall local tissue acidic condition. Wildzyme has peptidase enzyme present that includes a clearing away of fibrinolytic tissue and thinning body exudate that assists to clear the body's inflammatory response. This assists to vitalize the body's healing process by clearing away potential acid microniches. Inflammation is a vital immune response that assists the body from dysbiotic life colloid. Yet as one's inflammatory response is other than kept in control, acid microniches can have formed and the immune system can make errors in recognizing what is healthy from what is unhealthy. Excessive inflammation can result in neoplasm, Alzheimer's, arthritis, diabetes, lupus, emphysema, MS, cardiovascular disease, fibrocystic condition, IBD, migraine, cysts, and many other body conditions. Jubbs cell rejuvenation applies formulas that have their oxidative metabolic enzyme intact. Most enzymes on the market are fermentive. An inflammatory condition that is overactive can be successfully healed by applying nutritional fasting, alkalizing the body, along with the use of anti-edemic, proteolytic, and fibrinolytic enzyme formula. Inflammation, uncontrolled, cleared up, reduces a body's acid tumor microenvironment. Neoplasm in humans is where there is an imbalance in cell sugar metabolism and acid hypoxia. Clearing up acidity of uncontrolled inflammation involves assisting cells to keep their proper pH. On this note, high alkaline therapy, life food, nutritional fasting, and increasing the body's ability to transport oxygen all go hand in hand. Stress-related illness and disease. A human is amongst the only animal that can have become stressed from illusory mental activity. Allostasis refers to the body process of maintaining stability while under some physiological change. The allostasis process is initiated as the body responds to fear, flight, fright, or fight, real or imagined. How actively and long the body responds to manage the real imagined emergency creates an allostatic load. That load can have caused the body to have become sensitized to a stress-related disease, even cancer from injury. Maintaining the internal environment of the body is called homeostasis. Temperature, heart rate, glucose, oxygen, and carbon dioxide must be maintained, otherwise a life-threatening situation can have arisen. Variable change made to maintain internal milieu is the body's allostatic system. Allostasis is the body's response to imagined or real fear as it prepares the body and its energy reserves by providing energy to parts needed in case of flight or fight. The cardiovascular, hypothalamus, enteric, pituitary axis, CHEP axis, is the body's centralized organs that allostasis evolves around. Salmon, as part of their life cycle, provide a good example of the flight and fight response as they make their way upstream to spawn. One allostatic response is for albumin, a blood plasma protein that transports all nutrient invertebrate animals to have become reduced while room is made in the plasma for inflammatory and immune protein. Another example is how life forms debulk themselves. The nervous, cardiovascular, musculoskeletal, endocrine, and immune system all function and respond to perceived and real stress in a similar way as for salmon, as for humans. The CHEP axis is found in a salmon as it is in a human. Salmon have a hypothalamus, pituitary, pineal, cardiovascular, endocrine, enteric, and immune system. A salmon has three components of the nervous system: the autonomic nervous system, composing parasympathetic and sympathetic, and enteric nervous system, the brain of the gut. Salmon swim thousands of miles to spawn. Cortisol stimulates the gut of the fish to shrink and for the fish to drive forward without food. The salmon's instinct magnetically drawing it to willingly swim thousands of miles toward its own creation, to be released from the heart. Endogenous opiate is also released throughout the body that act as a secondary messenger system, also quietening inflammatory response from stress of being in flight or fight mode. Salmon, as do humans, learn how to move toward what is attractive and away from what is other than pleasant. Muscle growth is a luxury that can have been postponed until the perceived stressor has been managed. Salmon migrating towards the upstream areas they will spawn in can have swum for some 9 months. These salmon generally show signs of severe stress. High levels of the stress hormone cortisol has exhausted salmon's energy reserves. Stress hormone wreak havoc on the salmon's immune system. By the time salmon have spawned, cortisol has had a devastating effect on its body. Salmon, after the long journey to spawn under the influence of cortisol, die of massive infection. Allostasis coping, by albumin having been lowered and cortisol having been raised, are only some of the body adjustments made to enable the life form to deal with stress. An animal having experienced a constant threat of initiate the CHEP axis. The heart rate is the largest organ in the salmon, as with all vertebrates. The hypothalamus senses electrochemical signal that regulate endocrine response. The enteric nervous system of the salmon, the brain of the gut, is without a direct connection to the fish's brain, the same as all vertebrates. Most of the serotonin causing the fish to feel an I got it response arises from the nervous system of the gut. How relaxed the salmon is on its journey sometimes allows it to make it back into the sea after spawning. Salmon rest sometimes for up to 4 weeks in slow-moving water. Salmon show a fear response of fleeing away from sudden water change. Allostasis is initiated by some perceived threat, and an intricate network is set up by the Chep axis. How relaxed this fish is in its stomach releasing serotonin, feel-good neurotransmitter, versus adrenaline released from little saddles that sit above the kidneys involved in flight or fight response, has its telltale signs on the fish's overall body terrain. The primary role of adrenal stimulation is to mobilize maximal energy potential to maintain vitality. Salmon are startled by noise made on the surface of still water and by other natural forces in their environment. Their response mimics all vertebrate response to stress for allostasis hinges around the Chep axis for the salmon as it does a human. Cortisol unchecked from the salmon's adrenal gland to sequester stored blood sugar and dampen inflammatory response can have placed an allostatic load on the salmon that caused it to other than have excellent energy to maintain its body terrain. The allostatic load placed on the salmon as it swims upstream to spawn and be part of its own creation. How relaxed this fish can remain can enable 1 in 10,000 to escape back into the sea for another 4 years. The salmon's exposure to adrenaline initiated by the Chep axis can have placed an allostatic load on the fish's body that it was unable to eventually manage. The allostatic load placed on the salmon in its drive to spawn and be part of its creation, and the enormous amount of cortisol exposure is a major cause of the salmon's death. Possums without any predators live nearly twice as long as possums that live amongst predators. Stress and its allostatic load of cortisol ages the possum in a similar way as it does for all vertebrate animal. Most life can have some stress momentarily, yet in between being chased by a predator, the animal's physiology returns to its typical rested state. Repeated and ongoing stress can have caused an allostatic load to have been placed on the animal, though, in a similar way as what can have happened to humans with repeated stress. Animals subjected to repeated stress can have gotten ulcers. Generally, though, any stressor is short-lived and the allostatic load the animal can have been placed under ordinarily subside. Chronic stress can have taken its toll on the cardiovascular system, though when an animal would have remained in flight or fight mode. A salmon's cardiovascular system responds by sending blood to its larger muscles. Heart rate rapidly would have been increased and blood pressure also. The allostatic load placed within the salmon's body of its Chep axis can only be sustained over short periods of time. Observation in nature have parallels with human beings. Most people report that they'd rather have been with someone who was silent than with someone who had 10,000 things to say. Serotonin is released around strong leadership, and it is other than excellent in people who have had other than social behavior. The primary condition most people seek a healthcare professional for is digestive insufficiency and digestive distress. Each of these conditions coupled with delusional mental worry, can have in a short time other than allowed an excellent physiology to ensue. As one is quiet inside, one is receptive to others. Being receptive to another's needed assistance, is what commerce is. The culture a company keeps is reflected in the language exchange between each other. With every word having a physiology, one can have been free of thinking in terms of what one likes, eustress, or dislikes, stress. Whole brain functioning is being timeless now by being without mental construct. This is the value of uncut wood. Social order creates greater mental health. Compassionate communication from a caring friend and avoiding critical relatives is far more powerful than an antipsychotic drug. One can have turned themselves on with good thought and turned oneself off with bad thought, and one can have been at the mercy of the mind. The mind can have been merely the wind blowing over the rubbish. Yet, what is other than original can have been cleared away, so all that's left is empty space without interpretation. This is I realization. Our natural focus is more a peripheral focus, processing things from the whole. Focalized vision and sensory processing is a narrowing down of the senses. Adrenaline assists in inhibiting extraneous sensory processing in the fear, fight, fright, or flight response. Humans are amongst the only animals that can have the CHEP axis on and running continuously, cannibalizing the brain and gut. Passively being moved is only a recent phenomena, and the human nervous system is still learning how to disengage from energy in motion, emotion, feeling, thinking, and visioning that was illusory. Stress began in the mind from a story or idea, and adrenaline was released. Insulin was released, and human growth hormone was inhibited. That person aged while stress was maintained. Allostatic coping, serving to sequester energy in time of requirement, can have in modern time become a blueprint for a disease. Allostatic response is sometimes unable to adjust itself. For instance, in humans with other than excellent blood sugar, calcium critical for running the endocrine glands may other than be sufficient. Serotonin and GABA levels, biochemicals that modify the alarm mode, may have become depleted. One's allostatic response can have got stuck in on or off mode. Adrenocorticotropic hormone, cortisol, adrenaline, norepinephrine are stress-related hormone and suppress their own production in a built-in homeostatic mechanism. This in turn adjusts the CHEP axis. One's allostatic response can have responded in an other than excellent way. Overbreathing can have been enough a physiological adjustment in the bioterrain to swell bronchial tubes of the lungs in the case of asthma or sinus for someone unable to break foreign protein down. Stress from illusory mental activity can have placed an unnatural allostatic load on a person, and cancer, mold, can have arisen from a simple injury. High fat and protein and a runaway sugar diet increases all of the stress hormones and causes trapped blood protein in the body to be other than cleared properly. A person with better social skill is generally more healthy than one with poor social skill. Human is amongst the only animal that can have become stressed from illusory mental activity. Allostasis refers to the body process of maintaining stability while under some physiological change. The allostasis process is initiated as the body responds to fear, flight, fright, or fight, real or imagined. How actively and long the body responds to manage the real, imagined emergency creates an allostatic load. That load can have caused the body to have become sensitized to a stress-related disease, even cancer from injury. Maintaining the internal environment of the body is called homeostasis. Temperature, heart rate, glucose, oxygen, and carbon dioxide must be maintained, otherwise a life-threatening situation can have arisen. Variable changes made to maintain internal milieu is the body's allostatic system. Allostasis is the body's response to imagined or real fear as it prepares the body and its energy reserves by providing energy to parts needed in case of flight or fight. The cardiovascular hypothalamus enteric pituitary axis, CHEP axis, is the body's centralized organs that allostasis evolves around. Healing endometriosis and pelvic inflammatory condition. Endometrium tissue lining the womb plays a vital role in reproduction. This lining undergoes change in order that it can maintain pregnancy. In endometriosis, little bits of endometrium tissue, endometriotic implants, developed in places outside the womb, uterus. Those implants are usually found in the pelvis base, pouch of Douglas, womb, ovary, bowel, bladder, and intestine. Strange protein, sugar, and fat having entered the intestine cause bile stone formation and incomplete digestion. Body intolerance of larger molecule passing into the blood can manifest in inflammation of the mucosal membrane of the intestine where that protein was absorbed. On average, there is a pound or more of friendly bacteria in a healthy person's gut. This friendly bacteria is the body's first line of defense against dysbiotic foodstuff, bacteria, mold, fungus, and yeast. That dead food and fermentive critters can have become a volatile invader of the interior of the body. Strange protein, mold, fungus, and yeast, other than kept out of the body, can have wreaked havoc on any organ system that already was under some stress. Strange estrogen, environmentally and conjugated estrogen having accumulated, coupled with pelvic congestion from bile dysfunction, can spell a myriad of disease, including endometriosis, cysts, urinary interstitial cystitis, neoplasm, connective tissue disease, skin, yeast, bacterial, blood, lymph, and organ dysfunction. Bacteria from the gut generally flows in one direction, emptying through the ileocecal valve from the small intestine to the large intestine. Slow transit time of food stuff through the small intestine and poor fat digestion spells dysbiotic bacteria, mold, fungus, and yeast. That condition, along with a myriad of strange protein from non-life food eaten, can have caused an onslaught that an immune system can other than keep up with. Immune cells have about 3-month lifespan in an ordinary person. Eliminating all dead foodstuff and toxin for 3 months rests one's immune system. Immunoglobulin producing cells are the body's immune cells, and these are found primarily in the small intestinal mucosa. It's estimated that there is about 10 to the 10th immunoglobulin producing cells per meter in the small intestine alone. I think that's 1 trillion. Immunoglobulin cells, 80% stem from the small intestinal mucosa. As this intestinal mucosal body is first maintained intact, this heals the leaky dam. Better intestinal hygiene raises the blood protein supertransporter albumin in the body. Upstream healing initiates downstream healing. Eating one food that offends often can be enough by itself to exacerbate compromised immune system. Distension and inflammation of the intestinal tract that displaces other parts of the digestive tract and pelvic organs, coupled with mycotoxin that are, among other things, vasoconstrictions of blood flow to the periphery of the body. Pelvic organs can have most been compromised. One can have innovation today or remain stuck with yesterday's solution. Wheat, dairy, flesh, potato, bean, corn, and rice, having been eaten regularly, can all have created a major immune system crisis in the body. Colon and thyroid condition is linked to a person's pelvic condition. Your body works as a whole, yet the body would find what is expendable in comparison, and pelvic organ of reproduction can have been most hardly done by. Strange protein consumption can create a bushfire for zinc, B12, folic acid, magnesium, and chromium. Flesh food breaks down into purine as a waste. This molecule is similar to caffeine, and it has exactly the same stimulating effect. That is a fast pace followed by a sleep-like state. Dead food consumption initiates body congestion and infection is registered. Hemoglobin is lowered by all extraneous other protein element from immunity taking up most of the space on the highways inside the body. Endometriosis occurs as a leaky gut compromises pelvic organ. As the ovulatory cycle unfolds, wherein the cycle, there is a blanching of the endometrium. If foreign protein was present in the blood, that creates congestion, and its tissue and new toxin flow back into the pelvic area. That deleterious action can have infected the pelvic area, and that material, other than reabsorbed properly, affects other areas of the body. A life foodarian has the highest hemoglobin level. A healthy body can have overcome some radical health challenge through having good health through proper nutrition, rest, and exercise. Disease is other than an individual, as is a cat or a dog. Disease is a process of nature, kindly assisting you with a condition that has been placed upon self. True healing prevents infection at its roots. All else is merely trimming branches. This behaviorally is an unremitting attention from having awareness. Wisdom in this way is insight that control of one's appetite is nature's healing. Contagious disease is the accumulation of toxic debris. Celiac symptom, inflammation of the intestinal mucus lining, can manifest with many symptoms beyond endometriosis. It can be manifest through polyps, abdominal pain, indigestion, hemorrhoid, Crohn's disease, psoriasis, and neurological and blood, lymph, and organ dysfunction. Addiction to strange protein consumption can have a baby jonesing for a Cheerio. Children grind their teeth down, jonesing for Cheerios as dead food was brought in at an early age. The longer on is breastfed, the greater the immunity to ward off disease. Folate acid can have been drastically reduced after a bushfire, figuratively, burnt all available nutrient from the body. Because non-life food consumption and stress. Calcium can have become deposited in the brain and body, and that in turn can have caused seizures and neurological dysfunction. All manner of disease can manifest depending on psychosomatic condition, including dermatitis, herpetiforms, thyroid disease, lupus, diabetes, cardiovascular challenge, arthritis, and Sjogren's syndrome. Endometriosis and many other diseases begin with an inflammatory condition of the intestine, precipitated by the consumption of strange protein, sugar, and fat. Vitality can clearly be shown to be other than kept after the age of 2, after dead food consumption started. Strange compounds from dead food consumed can have triggered an inflammatory reaction of the intestinal mucous membrane. Body response to toxic debris is superb. Disease is the perfect body response given the circumstance of toxin and lack of nerve force. One's body response to dead food is to reduce available surface area that can actively participate in digestion and assimilation. Anemia is the perfect body response to toxic debris in the body and lack of adequate nerve force. Iron and other mineral is absorbed in the small intestine, yet under the influence of inflammation and available absorption site reduced, electrolyte and nutrient imbalance can have occurred with an individual. Feeling drowsy, urinating challenge, teeth grinding, irritable bowel syndrome, respiratory congestion, attention deficit disorder, urinary and reproductive pelvic inflammatory condition are created by the body's adaptive response to toxin consumption and lack of nerve force. Cold extremities and tingling fingertips is the effect of mycotoxin produced by dysbiotic bacteria other than allowing proper peripheral blood flow or nerve force. Blistering skin is the effect of deep nerve cells clearing debris that was the result of eons of body responses. That material is exited by creating a channel along a nerve cell to the surface of the body. Antibodies tests today can assist a person to discover what food allergen one may have a sensitivity to. An adaptive biological response of the body indicating inflammation of the intestinal tract was reported far back in 1888. Gluten was proposed as a culprit of celiac disease in 1955. When grain consumption has declined in history, so too has the amount of people suffering from celiac disease epidemiologically. Digestive and assimilation challenge can run in a family. A predisposition to strange protein sensitivity has been found in chromosomes that are linked to gluten sensitivity. Adequate surface area is required for maximal compounding of colloid in the manufacturing of blood from a process of colloid aggregating, then these colloids fusing, then these fusions differentiate, develop form. Strange protein reduces the surface area for blood formation to occur. It creates inflammation at the absorption site of the intestine. A leaky gut can flood the body with protein of all kinds that become a debris that has to be continually cleared from the body. Reabsorption of menstrual blood of the uterine lining occurs as there is clean blood. As there was things like baked bread in there, that stuff causes sediment to be in the blood. In that case, pressure ruptures vessels so it's bled out. The endometrium can have easily blanched itself in the ovulation cycle as there was other than any debris in the blood that was deposited. Pressure can have come to bear on organs, especially the uterus, ovaries, and vagina. In the same way, pressure from distension and inflammation of the intestine can displace a colon and or uterus. Intestinal structure can have displaced ovaries and bladder. Mold, fungus, yeast, and dysbiotic bacteria excrete mycotoxin into their host. Those little critters' excrement, among other things, are potent nerve toxins, vasoconstrictors of blood vessels, and neoplastic growth factors. Cold hands, frequent urination, sweaty palms, headache, lightheadedness. The menses can have been clotting or have been too bright, excess sugar, or too dark, excess protein, or yeast infection, are all due to an other than vital digestive tract. Antibody testing can be done on a live food diet, ELISA assay, to determine that if you have a vital immune profile. Proline-rich protein called gliadins are released from starch, like wheat, when that food would have been ingested, and antibodies form to that and other material like that as well. Congestion can have caused the egg to be released other than properly from the corpus luteum. Progesterone is needed to inhibit this. Yet most on a cooked food diet are estrogen dominant and progesterone deplete. That condition manifests cysts and fibroids of the reproductive organs. Dioxin is a toxin that can be found in those who eat flesh and drink cow milk. Dioxin is a toxin used also to bleach things. It is wise to use only natural material for one's personal hygiene. Loss of weight beyond 5 pounds per month can put one at risk for dioxin contamination, as that chemical was released from fat cells. One slice of white bread can be enough weight in the pounds back on overnight. Bloating and water retention can occur with just one slice of white bread. Detoxification can go gradually and smoothly if one is pregnant or breastfeeding. Molecule like strange estrogen and dioxin is made larger and inert through a process involving sulfotransferase, PST. PST clear leftover waste from the blood by the liver and swept out of the intestine in the feces. Conjugated strange estrogen, other than swept out properly from the body, cause water to be retained in between cells. That can have created uterine cramping and hysteria for lack of inhibitory neurotransmitter, yet excess excitatory neurotransmitter. Excess estrogen causes copper to remain high, which is known as a nervous stimulant. Excess estrogen inhibits metabolic producing enzymes and causes iron to be low in women who are menstruating. Excess estrogen is known as a factor promoting a cyst-like condition of the pelvic area. Supplementing with B6, B12, folic acid, magnesium, and zinc act as a natural diuretic. Excess estrogen can have been antagonistic to thyroxine, thyroid hormone. Stress hormones complete with progesterone synthesis, and this raises estrogens, debilitating effects. Antibiotic use can have destabilized friendly intestinal flora. Thus, estrogen can be 60 times what is found normally in the feces. Incremental weight gain, irregular menstruation, fibroid and cyst formation, edema, water retention, craving, and lack of sex drive are all due to the effects of excess estrogen without a proper level of progesterone to balance this. Food consumed may have contained pesticide, dioxin, PCB, and nonylphenol that have an estrogenic effect on body cells. Contamination occurs from packaging and in other ways too. For instance, plastic wrapping leak into food it has wrapped like cheese flesh, milk cakes, and sweets. Yet flesh and milk contamination occurred by animals eating food there is dioxin, pesticide, PCB, and nonylphenol pollution. Proper liver and bile function is critical for the body to sweep those toxins out. Protein consumed is broken down into tiny micromolecules. Substances that are smaller than 0.04 millimeters diameter can have escaped through a cell membrane. Larger undigested protein can have escaped into the interior of the body of the intestinal tract, was breached by fungal root from Candida albicans or alcohol, steroids, detergents, and other solvents like compound, heavy metal, and stress. Endometriosis is where tiny implants of endometrium, lining of the womb, have backflowed because of toxin and other than excellent nerve force. Those little implants can have settled in places like fallopian tubes, ovary, uterus, bladder, vagina, and colon, and faraway places as the nose, small intestine, spine, navel, diaphragm, and appendix. Endometrial tissue is responsive to hormones, and so that tissue can have increased its metabolic rate from the influence of estrogen. Progesterone gives a signal to endometrial tissue to excrete its supply of fat, protein, and sugar. An implant of endometrial tissue releases its secretions into those body places mentioned above, including prostaglandin E. Prostaglandin E stimulates excruciating pain. Prostaglandin F increases gut motility and is linked with irritable bowel syndrome. Prostaglandin F signals to the corpus luteum that something has implanted in the womb. That message can have been the reproductive system's first cry heard as an other than regular, healthy ovulation cycle. Prostaglandin F reduces progesterone output. It's primarily bodily produced by the corpus luteum, the casing around the egg of the ovary. As one can see, the body works as a whole. With PIC and endometriosis, discomfort felt is due to inflammation. Trapped blood protein can have caused pain. Both healthy cells as well as endometrium tissue implants are affected by the body's chemical-mediated immunity. For instance, histamine released around the site can initiate greater inflammation and congestion. A low level of progesterone and strange estrogen excess can have caused luteinizing hormone to be abnormally raised. Luteinizing hormone to be abnormally raised luteinizing hormone excess stimulates the ovarian follicle to ripen eggs out of turn. Follicle other than maturing within the natural cycle can have gone on to become a condition called polycystic ovarian syndrome. Insulin resistance due to strange protein toxicity can have challenged body cells with excess sugar. Excess sugar starves cells of needed oxygen, and metabolic processes can other than occur in an orderly fashion. Cells other than having kept their oxygenated metabolism can have switched to fermentation for their energy source. Life food nutritional fasting to restore one's great circulatory system with castor packs and suppositories is what the authors recommend. This, of course, is a true healing therapeutic, for this process involves one having changed one's ways. Live food nutritional fasting opposes excess estrogen from cooked dead food byproduct that can have accumulated in the body, and also the fiber from live food assists to sweep conjugated estrogens out of the body. Estrogen avoided of opposed naturally is an excellent prevention and treatment process for neoplasms. This is a powerful remedy for both women and men. An overload of estrogen can have led to a myriad of health challenges. Synthetic hormones is a great cause of cardiovascular disease. Growth hormones is injected into animals, and birds that are then fed to humans in plastics and non-organic oil can have all posed grave error. Urine therapy assists the body with PIC and endometriosis. The first urine of the day has a nice amount of melatonin, and 5 ounces collected fresh, implanted rectally before bed is an excellent cleansing practice. Melatonin inhibits cell division and totally blocks the growth of breast tumors. Urine is a powerful diuretic, assisting the body to clear excess water from between the cells. Resting the body so it can heal is very important. Resting from the continual use of organs is as important as anything else. Hypersexuality is created by the sexually rigged convention people live within. Yet one is in need of resting and behaviorally fitting in more to nature. Excessive leg crossing and psychosomatics involving conditions that are other than relaxed creatively and or sexually can have inhibited vitality of the pelvic area. Humans are the only life forms that can have worried oneself to an early death. For instance, humans have learned to do what is unnatural. Humans are without any apparatus to digest flesh. Flesh breaks down into microorganisms that eco-sterilize against healthy intestinal flora. People can have a thought to avoid flesh from cows and other land animals, yet erroneously considered flesh from fish to apparently fit as a lifefoodarian. Calcitonin found in salmon is only one example of that flesh's biological incompatibility. Calcitonin reduces body calcium reabsorption in humans. Calcitonin function in the human body is to deter calcium movement from the bone to the blood, and that has an inhibiting effect on bone growth. Life food is the ancient architect's design for a human, yet all synthetic and unnatural elements wreak havoc on nature. A strange hormone like synthetic progestin is extremely dangerous. A progestin is unable to be broken down properly by the body as natural progesterone is. Progestins pose a great deal of challenge to the body where there is only a great benefit from natural progesterone. Commonly prescribed progestin is dangerous. Progesterone is a vasodilator and is antispasmodic. Progesterone is a primary building block of much other hormone. Progesterone assists the body to neutralize excess estrogen. Progesterone sufficiency. A regular cycle indicates progesterone is sufficient. Menopause, ovulation having ceased, has blood levels of progesterone to other than remain vital. A woman can remain fertile for much longer than others have thought. Healthy lifestyle, proper nutrition, and exercise plays a role in how vital ovulation is, and how long ovulation remains, keeping menopause at bay. How clear the ovaries are of synthetic estrogenic chemical is a primary factor in how easily the corpus luteum of the developing follicle can produce progesterone. Follicle vital functioning occurs as xenoestrogen is kept at bay. There is a close relationship between adequate level of progesterone and calcium remaining vital in the bones. Progesterone, magnesium, silica, boron, and MSM are primary factors in assisting the body to maintain calcium in the bone. Menopausal osteoporosis can be reversed by making sure body progesterone is adequate. 1.2 million women in the United States suffer broken bones each year. That is a direct result of other than having adequate body progesterone. Estrogen slows the reabsorption of bone and is associated more with a decrease in bone formation. There is a 6-fold risk of endometrial neoplasm in those who have received 5 years of pharmaceutical estrogen. That same risk for long-term use of synthetic estrogen rises to 15-fold. Balancing, neutralizing, and managing estrogen is very important in healing body temperature challenge, tissue swelling, sexual organ atrophy, and infection. Progesterone, magnesium, MSM, and silica assist management of excess estrogen. Yet a true healing therapeutic involves one living on life food and doing Jubbs cell rejuvenation program to cleanse and restore vitality. Estrogen dominance over time can have caused tissue insensitivity to estrogen. Supplementation of progesterone naturally can initially increase body sensitivity to estrogen in a smaller way that it stimulates initially an overreactive thyroid before it assists in normalizing thyroid function. Estrogen refers to quite a number of similar hormonal compounds, including estrone, estradiol, and estriol. A progestin is a synthetic hormone that by its structure inhibits the body mechanism from it being cleared properly. A progestin can act also in a manner estrogen does when the body was out of balance physiologically. Dangerous synthetic version, progestin, of the real hormone called progesterone inhibits ovulation. Progestin can have inhibited luteinizing hormone being released from the anterior pituitary. Luteinizing hormone stimulates ovarian egg production. Normal progesterone production by the corpus luteum halts ovarian egg production. Thus, progestin acting as a real progesterone interferes with progesterone production naturally in the body. Life food abounds with natural hormone-like compound. These compounds activate prostaglandin dehydrogenase enzyme and steroidal dehydrogenase enzyme pathways. Life food can assist one to help manage excess estrogen. Estrogen excess can come from bile other than being swept from the intestine properly. Healing this and the intestinal mucosa requires vigilance that one become aware that many compounds in dead food mimic estrogen. Excess eating of strange sugar, fat, and protein can have all ended up as estrogen in need of being cleared from the body. Conceiving, or other than conceiving, one can sense one's internal cycle most by sensing the changes of one's saliva and cervical secretion. Both secretions have the property of stringing, spinbarken, between the fingers at the time of fertility. Menses marks day 1 of one's ovulation cycle. Day 10, one can be more wet and spinbarken is evident in cervical secretion. This lasts until one is complete ovulating. At this point, cervical mucus becomes tacky. As one is healthy and exercising, there is only a clear mucus discharge at the end of the cycle. If debris was trapped in the spaces of the endometrium, an endometrium membrane hemorrhage occurs, and that material new toxin is exited out to maintain one's procreative space remaining fresh. Spinbarken occurs generally around day 10 of one's ovulation cycle and is complete about day 12 or 13. Progesterone applied in 15-minute intervals to resolve a symptom can clear most of all of the estrogen or dominant and unwanted effect, including migraine headache and cramping. Progesterone that is micronized and suspended in an oil base works best. Progesterone is a vasodilator and can be broken down to other useful hormone until it is cleared from the receptor and body. A progestin, because it is without this ability, wreaks havoc on the body's hormonal homeostatic regulatory system, for it cannot be properly cleared from the body. Progesterone receptor cells can be found in the brain stem, limbic, emotional, eyes, nose, throat, lung, breast, liver, adrenal, and vagina. Body symptom can heal spontaneously with enough natural progesterone. Without enough progesterone, estrogen production is increased. Progesterone deficiency raises GnRH, gonadotropin releasing hormone, and FSH, follicle stimulating hormone, and LH, luteinizing hormone. That condition can have led to adrenal exhaustion and edema. Progesterone is so amazing, it has assisted many as a single supplement to remain PMS-free, cystic-free, bone density vital, and seizure-free. What is menstruation? Life is active and death is inactive. Life food is active and dead poisonous compounds are inactive. All living structure is made up of protein, fat, sugar, and mineral. All life food protein can be broken down to water and gas. A drug and dead inorganic material is without any substance to overcome its own inertia. A drug is acted upon. All cooked food has to be acted upon. Health means whole. In Jubbs cell rejuvenation, disease is only a body's adaptive biological response. Disease could have been in an active phase or a resolution phase. Disease is the body's response to clear morbid debris. Menstruation is a cleansing given a state of debris being in the blood that became deposited in the endometrium. The powers of life can have other than remained where there was food and sexual excess. Hemorrhage of the endometrium membrane at the end of the ovulation cycle is considered normal. Yet as the body is vital and the blood clear of extraneous strange protein, blood within the endometrium at the end of the ovulation cycle is reabsorbed by the body. A clear discharge marks the end of the ovulation cycle. Leucorrhea is the elimination of a viscid, whitish discharge vaginally and from the uterine cavity. That discharge is the body's response to inflammation and irritation of genital organ mucous membrane. As systemic elimination is excellent, there is nothing to discharge from the uterus. Menstrual discomfort is paired to the severity of one's mucus discharge. That condition only occurs as other channels of detoxification are other than excellent. Bile, other than having flowed properly, is the cause of foodstuffs putrefying, fermenting, and becoming rancid in the small and large intestine. Leucorrhea is evidence as such of a toxic condition. Erring from a life food diet can have seriously challenged the physiology that has constitutionally been adapted over eons of time. Menstruation is a hemorrhage. All hemorrhaging is pathological. Vitality of the body can have been slowly sapped by imperceptible degrees. Menstruation is a pathological hemorrhage that involves a reduction of vital essence. Menstruation is a healthy body response given that debris is present and was in need of being cleared. Hemorrhage, though, is other than a normal condition of health. Menstruation is a cleansing condition of a pathological terrain. Amenorrhea is mostly the pathological condition of an absence of menstruation, where one would ordinarily be in need of cleansing yet is other than able to. A polluted blood generally requires that one's endometrium would cleanse itself of impurities, yet that also requires a loss of vital essence from the blood. A body can adjust itself. Given the circumstance that cleansing through a hemorrhage of the endometrium is sacrificed because of a body. Requirement of a conservation of vital essence, immune cells do what they can. Yet the task of cleansing from strange protein day after day can have become formidable for the body, and pelvic organ is seemingly other than as vital as other organs. Thus, pelvic condition can have arisen. Runaway sugar and undigestible protein from starch causes a menses that has a slight odor, yet a bright red and generally more profuse flow. That condition can have been followed by cramps because excess sugar in the blood robbed magnesium from the body that allows the muscles to relax. Flesh, bean, and cheese eating can have caused the menses to have been dark, clotting, and stringy. Undigested protein in the intestine putrefies and breaks down into E. coli that burrow into the intestinal wall and eco-sterilize against friendly bacteria. High-temperature cooked protein, fat, and sugar create a putrid waste in the intestine that causes an other than pleasant odor in the menses. With great duress, the organs of reproduction can have become a dumping ground to assist the body to eliminate putrid waste eaten. Clean and vital blood sees simply a clear mucus discharge at the end of the ovulation cycle. The greater the cleanliness of the blood, the more the body absorbs the element of the blood congested in the endometrium back into itself, the shorter duration of the flow. Natural conditions of life support ovulation occurring cyclically with simply a clear mucus discharge at the end of the cycle. This can reduce to nothing necessarily lost of one's vital essence. Hemorrhaging uterine membranes is the end result of eating dead non-life food. Improved vitality causes the menses to get less and less. Ovulation and menstruation is other than always coincident. One can have been in ovulation yet menstruating. Toxic blood causes the endometrium to hemorrhage. Muscle and structure, other than having remained vital in the abdominal area, is a factor contributing to endometrium hemorrhaging. After ovulation, the endometrium, mucous membrane, of the uterus thickens in case of conception. As conception has other than occurred, this body material is simply reabsorbed. Sloughing of the mucus layer at the end of the cycle can have been accompanied by capillaries having strange protein laden from the blood deposited behind that initiated a hemorrhaging out that debris to clear the space of procreation. Strange estrogen, other than metabolized, can also have wreaked havoc on the precious vital homeostasis nature intended. Vitality is the absence of leucorrhea. A life food regime can other than undo that toxic condition. One can do Jubbs cell rejuvenation, which is based on the principle of upstream clearing. Exercise vigorously, and you can burn as much of the toxic debris from dead food consumption. Menstruation is a major factor in anemia in women. Blood loss is a serious strain, weakening the body from remaining vital. Precious organic mineral like iodine can have been continuously been other than kept through menstruation. If menstruation was allowed to continue unabated, neoplasms can have arisen. Neoplasm generally only occur during the time you can have menstruated. Inflammation, hemorrhage, cycle exposing the endometrium and uterine muscle, fallopian tube, ovary, and vagina to toxic debris from dead food consumption. Neoplasm of the pelvic area for her follows the time one has been having a cycle of menstruation. Much neoplastic condition of the pelvic area is amenable to Jubbs cell rejuvenation. Leucorrhea is the reducing body condition of filth in the blood. That dead food consumption exhausts the body to sterility. Menses is influenced more by diet than anything else. Sexual excess can have impeded intellectual activity. Testicles and ovaries exert over the mind and inner strength. Nerve energy maintained is a long life. Enervation, lack of nerve force, is what can inhibit the body from eliminating toxin accumulated from cooked dead food consumed. Excess estrogen inhibits metabolic producing enzymes and causes iron to be low in women who are menstruating. Excess estrogen is known as a factor promoting a cyst-like condition of the pelvic area. Supplementing with B6, B12, folic acid, magnesium, and zinc act as a natural diuretic. Excess estrogen can have been antagonistic to thyroxine, thyroid hormone. Stress hormones compete with progesterone synthesis, and this raises estrogen's debilitating effects. Antibiotic use can have destabilized friendly intestinal flora, thus estrogen can be 60 times what is found normally in the feces. Incremental weight gain, irregular menstruation, fibroid and cyst formation, edema, water retention, craving, and lack of sex drive are all due to healing migraine headache. One's sense of smell and hearing can have become agonizingly acute. Noise nearby can have become unbearable. In extreme cases, one can have vomited violently every 20 minutes. This scenario can be other than an uncommon reality for the migraine sufferer. At first, there can have been a series of happy moments. Then the eyes can have played tricks. Approximately 28 million Americans suffer from migraine headache. 1 in 5 migraine sufferers experience a visual shimmering that can have occurred as a sudden stabbing pain. A migraine can have begun in the front of the head that can have started the head throbbing. A neurological event can have occurred for the migraine sufferer who is other than helped medically. Migraine, cluster, tension, and other brain and nerve condition from TMJ to brain tumor conditions are all treated as a bad joke punchline. Friends sometimes consider the headache sufferer to have a deeply repressed memory or to be avoiding some activity. These ideas are now changing rapidly. Scientists using sophisticated imaging of the brain during a migraine attack have been able to trace the neurological pathways to the root of the throbbing. Trigger factors initiating a migraine combine over time and eventually cross one's neurological threshold. Diet, hormonal challenge, stress, lack of sleep, allergen, and barometric pressure change can all have been involved as combined triggers. Health practitioners divide headache into two categories. A primary headache is self-contained. A secondary headache is the result of an accident or another illness. Treatment of a secondary headache depends on the origin of the headache. Recent developments have altered the idea about headache that has been held since the 1600s. Several imaging techniques have allowed doctors to examine blood flow in a living person during a migraine episode. In the past, the idea was stated that increased blood flow to the brain was responsible by putting pressure on associated nerve cells, and in turn having caused pain. That is other than simply so. Brain imaging and blood flow studies during a migraine episode have shown the dura mater nerve ending to be initially involved. This neurological action releases protein that vasodilates and provides support for nerve cells to maintain a high state of alert. Dilated blood vessel in the brain is the result of a migraine headache's progression and is other than its primary cause. Affected nerve ending in the dura mater have been traced back to a complex of nerve fibers called the trigeminal nerve complex. This nerve plexus transmits electrical signals to other areas of the brain from the jaw and face. An activated trigeminal nerve complex pours pain messages into the brain. The trigeminal nerve complex is involved in cluster, tension, and all other primary headache. Characteristics of the type of migraine headache are the result of the body's response to what triggers have been activated the trigeminal nerve complex. Migraine headache sufferers have become neurologically conditioned to overreact to stress. For one who has suffered a migraine, a neurological sensitization has occurred. As the trigger mechanisms eclipse one's neurological threshold, the more powerful the migraine system that would have been activated. The greater the triggers and the lower the neurological threshold, the more compounding discomfort to the migraine sufferer. The healing of acute migraine episode and prevention of future episode involves resetting one's neurological threshold for pain at a normal level through Jubbs cell rejuvenation. As this has occurred, the brain gains back its ability for pain management. For one who is yet to heal, the brain has other than its natural ability to suppress pain. The periaqueductal gray matter of the brain is involved in turning the pain response off, so one's focus can allow one to survive. However, when a migraine would have occurred, oxygen can have flooded the periaqueductal gray matter of the brain, causing iron to have been deposited in that area. Bringing relief to migraine headache suffering involves a lifestyle change. Modern medicine is the art of keeping people mused while nature takes its course. A drug treatment neurotransmitter or hormone, such as serotonin or natural progesterone, is generally other than administered because a patient can other than be sought for this. A patent can other than be sought for this. Having enough serotonin and natural progesterone quietens the pain message. It also inhibits and soothes the nerve endings of the dura mater. Nutrition in modern medicine has other than been considered as an important factor in healing primary migraine condition. In clinical practice, there have been thousands of migraine sufferers assisted by switching to life food. This is a flesh, starch, and dairy-free diet, where food is prepared in a way that it maintains its life force. Life food is digested and assimilated in a manner that costs the body nothing. Emotionally less than well and other brain challenge result from the modern diet of dead food, gluttony. As life begets life, and dead has begotten dead. Dead food contains an other than welcome and indigestible storage protein. Wheat, rice, corn, and soybean is grass that contains storage protein. Elimination of dietary gluten, gliadin, glutenin from grains, and casein from milk will replace modern medicine and drug treatment for much brain disorder. Diet's impact on mental health has been demonstrated throughout history. Fasting has been used to heal mental affliction. In ancient Greece, insanity was healed with fasting and calorie restriction. Active research completed at the Royal Hallamshire Hospital in Sheffield, England, has uncovered strange protein to be a factor in a broad array of brain and nerve physical challenge. The negative consequence of consuming dead strange protein is endless. Brain disorder including migraine, headache, ataxia, senility, Alzheimer's, and epilepsy appear to be caused from the consumption of strange protein. One generally can transform and manage brain and nerve deterioration in the early stages through life food nutritional fasting. This is the way for progression of brain and neurological conditions to be halted. Late-stage brain and nerve condition can have continued to deteriorate despite one's lifestyle change, though most all physiological conditions like senility, multiple sclerosis, epilepsy, Alzheimer's, and Parkinson's disease can be reversed and slowed, especially in an early stage of the condition. Brain affective challenge such as migraine headache, hyperactive ADD, depression, mental lethargy, anxiety, aggressiveness, and failure to thrive are all assisted with life food nutritional fasting. The conditions mentioned above can be associated with significant healing because structural integrity of neurology can have remained present throughout the condition. Life food nutritional fasting simply changes the electrics through assisting the bioterrain to recover. The bioterrain equals acid-alkaline balance, plasma conductivity, and antioxidant vitality. Unlike senility, Alzheimer's, and multiple sclerosis, there may be other than any structural brain damage in many neurological conditions. Food affects electrics. Morphine-like strange indigestible protein derived from starch and other dead food is an important factor in the pathology of brain and nerve electrical conduction. Dead food consumption-induced illness, like insulin-dependent diabetes, can have affected brain electrics. That condition can have begun initially as a result of a leaky gut. Contamination of the blood can have occurred from relentless, strange indigestible protein consumption. Contaminated new toxin can have started the whole disease challenge. Dead food consumption can have greatly taxed the pancreas, destabilizing body chemistry and challenging brain and neurology to the point of migraine headache. Dead food antibodies can have wrongfully created autoimmune condition that can have affected brain function. Disordered blood within the body and the brain can easily be explained through the action of strange indigestible protein. Strange indigestible protein consumption can have triggered a neurological condition such as hallucination, migraine, epilepsy, multiple sclerosis, and a myriad of other conditions. These conditions can be considered the effect of aberrant protein having crossed the blood-brain barrier, affecting brain and body electrics. An animal or human fed dead food new toxin can have developed a large array of brain and neurological structure abnormalities. Irreversible brain damage can have occurred from celiac, Crohn's, and other inflammatory digestive condition. Antibodies can have also been entering the brain. Rapid improvement often follows as one begins life food nutritional fasting. Ergot is a mold that grows on glutinous cereal. A hallucinogenic drug called LSD is refined from that mold. Ergot is frequently found on rye. Migraine, seizure, hallucination, and a myriad of other brain electrical challenge can all be promoted by consumption of mycotoxin from mold, fungus, and yeast that was derived from grain alone. Rye mold is intentionally grown in a laboratory to derive migraine drugs. Mycotoxins are generally potent vasoconstrictors. Drugs derived from ergot are sometimes overused in the treatment of migraine, resulting in lame and gangrenous tissue. Mycotoxin from grain consumption is a potent constrictor of blood vessels. Neurotoxin and hepatotoxin have been found to be the primary cause of madness in the Middle Ages, called St. Anthony's Fire. Mood disturbance has frequently been ascribed to celiac and other inflammatory condition of the digestive tract. I said that already. Okay, excuse me. Brainwave patterns in those having suffered from ADD and those suffering from celiac, inflammation of the mucous membrane, have exactly the same abnormalities electrically. Celiac disease, cooked food, can be a common underlying condition in those having experienced migraine headache. Mycotoxin poisoning can have easily resulted from grain, flesh, dairy, and other dead food peptides crossing the blood barrier. Exorphin, mycotoxin, and other new toxin do affect blood vessel expansion constriction. These toxins also can drastically change brain and gut neurotransmission. Disturbance in neurotransmitters of the brain of the gut and the brain of the head involve similar substance such as secretin and serotonin. Both substances have been shown to be critically involved in migraine headache. These neurotransmitters and others exert a primary influence on mood, cognition, and behavior. Intestinal permeability and digestive enzyme complex interaction are highly affected by strange dead food protein consumption and improve dramatically as one has begun life food nutritional fasting. Autism, migraine, and other neurological condition can completely clear up on a life food nutritional fasting program. Dead food consumption can have resulted in antibody formation as indicated. Immune cross-reactivity is a primary concern in dead food consumption. Brain and body molecules that are composed of amino acid sequence similar or identical to new toxin consumed that wrongfully entered the blood can have posed a grave physiological immune challenge. One who has celiac and new toxin sensitivity can have specific autoimmune disease such as thyroid, pancreas, and a liver condition, and even rheumatoid arthritis. Blood, mineral, sugar, and essential fatty acid synthesis can all have other than been kept vital with habits other than life food. Essential nutrient being present allows for proper brain and body electrics. Treatment for migraine headache has mainly assisted in managing the condition with drugs and lifestyle change. Drugs used presently include triptan, ergotamine, dihydroergotamine, corticosteroids, beta blocker, antidepressant, and antibiotic. Lifestyle changes have usually involved the avoidance of fluorescent lighting, yoga, meditation, and avoidance of other acknowledged stressors. Migraine treatment at present is other than a true healing therapeutic. The lifestyle changes mentioned above, live food nutritionally fasting, a lifestyle of live food, and the avoidance of strange indigestible protein will assist one in having a true healing therapeutic. The recommended supplements for migraine treatment are MSM, magnesium, progesterone, blue-green algae, flax oil, borage oil, pregnenolone, and DHEA. Elements that assist in restoration of proper brain function are clearing away bile stone, improving liver and pancreas and intestinal function through live food nutritional fasting, as well as reducing electromagnetic smog. A diet of live food is rotated every 4 days after one has done nutritional fasting. In this way, actual stressors are cleared away. Over time, toxin is cleared away from one's body along with one's migraine condition. Otherwise, triggers like glutenin, gliadin, gluten, and casein can enlist the hypothalamus, the upper brainstem, and the trigeminal nerve, causing the dura mater to swell, blood vessels to enlarge, and pain to have flooded the brain. Live food nutritional fasting will soon replace conventional drug and psychiatric treatment for brain disorder, including migraine. For the health practitioner, practicing compassion when assisting one who has suffered migraine headache would be wise. Consider what it must be like to live with the vulnerability and uncertainty caused by migraine episodes and other neurological disabilities. Healing always occurs first with a change in one's feeling. This can occur with the awareness of permanent relief. Surviving anthrax in the city. With the World Trade Center burning, releasing toxin into the air, and recent scare of terrorist use of anthrax, fortifying immunity and securing air and water is a decidedly important strategy for most city dwellers. Both air and water was already unfit for maintaining vitality. Air and water systems are hot items for consumers presently, and yet one can take other steps to also gain true immunity. Maintaining the blood in a vital condition is more than simply securing air and water. Vital blood is dependent on processes involving body excretion. Eliminating toxins from the body may be far more important than feeding the body with ailment newly brought in. Elimination is vitally more important than feeding to gain true immunity. Respiration is the major process the body uses for neutralizing and excreting toxin. If respiration was burdened by new toxins, nutritional toxin, and other than working well, life also is without this vital function. Degeneration mostly occurs by having attempted to feed cells that are without heed of that feeding. That added debris can have affected cell respiration and is a major error that can have rushed one off to the chief undertaker, mold, fungus, and yeast. In lieu of anthrax that it was weaponized, particleized to be airborne, it is important to maintain vital immunity of the lungs for the support they play in respiration. It's an interesting fact that a body can have ceaselessly overcome dangers like Ebola, flesh-eating bacteria, in Africa. Other dangerous toxin from foreign colloid of life, spores, introduced into the body from the outside world only could have found a seat within a compromised terrain. Instead of having broken down, the body, given time, improvises and adapts to adverse circumstances. The more one's body is less vital, the longer and more unable the body is to react vitally. The more a way to tolerate adverse circumstance. That coping is with a loss of expression of overall vitality. A loss of vitality occurs as the body adapts to adversity. True immunity can have been mistaken for that body tolerance for a toxin. It is other than any matter that the toxin has come from burning remains of plastic and metal from the World Trade Center collapse, or vaccination and inoculation, or natural flavoring, excitotoxin, in food. A weakened body is unable to react to toxins than a vital body. Given time, the body adjusts itself. Only extreme sudden change that other than allows this body adjustment is other than safe. Body tolerance of a poison occurs, time allowing, at an expense of overall vitality. Already there are tons of environmental toxic chemicals, too numerous to mention, that have a variety of effects such as mimicking hormones that have a marked effect on the human body. At least 20 alkyl phenols alone contaminate drinking water in the United States, and these toxic chemical compounds act like weak estrogen. Chemicals as such have also been burning, polluting the air and water from the Trade Center collapse. Hundreds of thousands of human-made chemicals exist without any awareness of the effect these chemicals have on biology. Many wreak havoc on life. Science may be more than commercialization than considering long-term toxic effects of dangerous chemicals. A daily allowance of 9.6 micrograms per person per day has been set for various chemicals like bisphenol AA. A tolerable daily intake, TDI, is a reference of body weight contaminant ingested. That reference is typically set higher than what many researchers say should be allowed. Much scientific consensus is that many of these human-made chemicals should absolutely be banned. Strange chemicals having a chemical affinity for various organs, having tattooed the body, can interfere with one's natural ability to break down similar compounds produced within the body. Fat can have become a hazardous waste dump where the body can have stored biologically disruptive chemicals environmentally consumed. Anthrax and spores are other than very stable. There are people who have survived without intervention. What allows one person to survive, yet another to die? Anthrax is commonly found in the soil. Yet anthrax must be shocked chemically or thermally to be fractionated to a spore to be small enough to become airborne and more virulent, and then other spores are other than able to remain stable. Yet it is more the terrain of the body that counts. Just as the dirty kitchen sink would be more responsible for maggots on the kitchen sink than flies merely being present, so too with the body and anthrax or other environmental toxin. Fasting engages the body rejuvenation process, whereas feeding increases the degenerative processes. Growing up having health-destroying habits can have created a tolerance that a vitally fit person may be without. The body adjusts over time and develops a tolerance for a toxin. The body simply allows the toxin to be without booting it actively out. Vital immunity is the body's first reaction to any toxin, and that is a message of reaction by cleansing. For instance, laxatives slowly poison the body till more stronger poisons must be used to evacuate the bowel as body tolerance occurs. The more sluggish the body would have become, the more will be needed to get things done. Adaptation to toxins occurs at the expense of overall body vitality. Vaccination and inoculation other than create true immunity. Just the tolerance for the toxin, that's all. Tolerance for a toxin is other than true immunity. True immunity comes from having a clean body. Dulled nerves other than allow a proper vitality. That is the price paid for having tolerated a toxin. Extraneous debris in the blood, along with immune protein from body inflammation, can have crowded the space in the plasma for albumin. Albumin is the chief transporter of the chemical forces stimulating the cells to respire, as well as the great transporter of cellular waste. Albumin in the blood has been empirically and clinically observed to be raised by reducing extraneous body inflammatory proteins in the plasma. The Jubbs in their cell rejuvenation program witness bones, nail, hair, and skin all return towards optimal vitality. Many ailments heal or have partial remissions by improving one's overall health. The liver produces albumin as the osmotic pressure of the blood is reduced by clearing away immune protein, globulin. Active healing therapeutic considers clearing bile stones initially, and this greatly reduces inflammatory protein and thereby raises albumin. This is true immunity and other than simply tolerance. Cell rejuvenation applying life food nutrition, food having its life force intact, and changing one's ways is a true healing therapeutic. Real cell rejuvenation occurs by eliminating toxin from the body. There is only one disease really, and that's toxicity of the body. There is only one healing to have good immunity, and that occurs by eliminating and avoiding toxins. This is what creates good immunity. Cell cleansing that is recommended should be done sequentially. By assisting the organs above than below, thousands can be helped to heal and be more vital to resist anthrax and outside danger. Modern medicine, in comparison, is the art of keeping people amused while nature takes its course. Modern medicine's answer to immunity is a condition where overall vitality is other than kept. Antibiotics wipe out one's own first line of defenses by destroying the body's detoxifying force in the colon. Antibiotics wipe out friendly bacteria and create a greater amount of immune proteins, globulin, in the plasma than can have other than allowed albumin to be remained. Having high albumin and low globulin is indeed as a major factor inferring long life and intelligence. The Jubbs recommended life food and a 14-day cell rejuvenation program, as well as securing one's water and air. By reducing inflammatory proteins in the plasma, albumin is raised. Long life, intelligence, and the ability to resist disease is inferred by having high albumin and low globulin in the plasma. In light of the fact that the management of the anthrax scare with ciprofloxacin, an antibiotic, the only government-approved treatment, causes more inflammatory protein to be present in the plasma and less albumin. New York City was attacked September 11th, yet the healing needed from an information deficiency in recent weeks seems likely to be more of a challenge to overcome. Unknown health risks of strange protein consumption. Wheat, corn, rice, bean, potato, milk, flesh, and cooked food, and nut is substance experts have labeled as allergens. Those foods can have caused an immediate hypersensitivity reaction in some people. Inflammatory reaction to strange protein consumption can have occurred immediately within an hour and stimulates an antibody called Immunoglobulin E, IgE. Immediate immunological reaction can range from cough, eye and facial swelling, shortness of breath, challenged swallowing, swollen tongue, phlegm, fatigue, perspiration excess, runny nose, hives, bloating, a feeling of being stuffed, elevated or low blood pressure, loss of consciousness, anaphylactic shock, and death. A less dramatic response can be delayed and is even more common. Immunoglobulin antibodies such as IgA, IgG, and IgM can have occurred within hours or even days after strange protein consumption. Challenge with sleep, restlessness, constipation, gastrointestinal discomfort, migraine, chronic fatigue, emotional and cognitive challenge, sinus, eye and ear health challenge, joint pain, bedwetting beyond normal as a child, and other unexplainable symptoms have been linked to the above mentioned immunoglobulins. Intolerance and food sensitivity may other than necessarily stimulate an immune response. Yet, trigeminal nerve pain, headache, stomach ache, joint pain, and bowel that other than empties properly can all be due to a metabolic mechanism of gastrointestinal disease. Gastrin secretin, GABA, serotonin, and other essential neurotransmitters are produced in the brain of the gut. For instance, 95% of all serotonin in the body is produced by the brain of the gut. The nerve force of the body and brain of the gut requires a proper bioterrain. Dead food consumption can have other than allowed proper electrical valence of body cells, of body nerve cells. A body response of any discomfort or functional challenge to new toxin, nutritional toxin, is a message that something has erred from nature. A sensitivity to strange protein can have been so severe that even a lip kiss from a loved one can have caused one to die. This has happened with peanut. Peanut is even more poisonous than soybean. Allergic reaction and disease is on the rise as there has been an increased intake of strange undigestible protein in modern processed food. It is wise to consider this as a public health concern of critical proportion. Death can have occurred from eating a food that contained strange undigestible protein. A low level of soy protein as an addictive meat a low level of soy protein as an additive meat, bread, and pastry extender can be consumed as small as only 1 gram can have caused death and other serious health challenge. Reaction to strange undigestible protein consumption can have other than occurred immediately, with cause and effect difficult to pinpoint. The food allergen can have remained unknown in 1/4 of the cases of anaphylactic shock. The 90s saw an increased prevalence in new toxin-induced anaphylactic shock compared to the 80s. Plastic peril, altering the Earth's biology. Environmental toxic chemicals too numerous to mention can mimic hormones and can have had a marked effect on the human body. If someone has eaten clover in a proportion that would other than ordinarily be normal, it is possible to have drawn a substance like isoflavone into the body that can have acted like a weak estrogen. Isoflavone, weak estrogen, is about 5% of the total substrate material of clover. Other weak estrogens, like coumestans in sunflower, alfalfa, soybeans, peas, spinach, and some clovers, can be 30 to 50 times more potent as an estrogen than isoflavones. Coumestrol is only 10 to 20 times less potent than 17B estradiol, a commonly prescribed hormone. Acid lactones found in wheat and corn have also been found to act as weak estrogens. Reproductive abnormalities of male mice positioned between females in the womb can receive 20 part per trillion of estradiol, and that increases enough to affect masculinizing. Hormones program how DNA responds for the rest of the animal's life. Human-made chemicals and those naturally released can have become endocrine disruptors of animals and humans. there is a serious spread of environmental toxins. Reports of this and other related stories have yet to be received by the media and general public because of vested interest. The truth has been subverted for private growth. Estrogens in the environment that are human-made compounds are now in the drinking water. Ethanol estradiol is extremely potent and causes female secretions in male fish as low as 0.1 nanograms per liter. This is equivalent to 0.1 part in a millionth of a millionth. Estrogen blocks growth hormone inhibition and is a yeast hormone. Estrogens like nonylphenol that are leaked from plastic tubing, this chemical helps create flow and binding in paints, plastics, and lubricating oils. It is also found in agrochemicals and toiletries. And in combination with other chemicals can have created a cocktail effect of hormonal disruption. Alkyl phenols, which at least 20 are found to contaminate our present drinking water, are another example of a weak estrogen. And this is just one example of a chemical compound among many produced in industry that have found their way into the water supply. 20,000 tons of similar chemicals have been annually used in Britain. These chemicals can be commonly found in vinyl flooring, common food storage containers, furniture, countertops, automobile interiors, and children's toys. Toxic substances like bisphenol A is similar to DES, a well-studied chemical which has major estrogenic-like effects. Other substances like phthalates, BBP, butyl benzyl phthalates, DBP, dibutyl phthalates, all show weak estrogenicity. Unfortunately, these chemicals are employed in every part of industry where the goal is to impart flexibility in plastics. Hundreds of thousands of human-made chemicals exist without the public's awareness of the effect these chemicals have had environmentally. Biologically, they have already wreaked havoc on life. Many of these chemicals are highly volatile, and exposure has occurred to all of life through physical contact via air, water, and food intake. Many store-bought containers and packaged food and water release a cocktail of estrogenic chemicals that are known to cause cancer. Cancer cells can have divided out of control. There is a daily allowance of 9.6 micrograms per person per day of a migration of bisphenol alone. The tolerable daily intake, TDI, is a reference of body weight contaminant ingested. This is typically set higher than what researchers say should be allowed. In the light that confirms that phthalates are estrogenic, the scientific consensus is that these chemicals should be absolutely banned. Plastics pose a great peril in their contamination of food. These sex-changing chemicals can be found in milk and an enormous array of other products consumed. And environmentally employed. The sum of all exposure needs to be accounted for, as there is such a phenomenon as the cocktail effect. Very small doses of these individual chemicals compound their effect together and increase their potent toxicity. Pesticides and toxic chemicals can disrupt multiple sites of the body. These toxins can disrupt the body electric, affecting reproductive, thyroid, and adrenal function. Effects during development are permanent and lethal. Containers can leak phthalates. In fact, these toxins are so prevalent in society, they are now commonly found in drinking water throughout the world. Cities and large metropolitan areas have yet to test for this type of contamination. Most eating utensils and dishes have been washed with toxic detergents and bleaches that contain estrogenic and androgenic disruptor chemicals. Fresh vegetables can have pesticide and herbicide residue that is systemic, found throughout the plant. Chemicals of concern are mostly fat-loving compounds which can bioaccumulate in mammal tissue. However, as we would all expect and wish our children to be born chemical-free, unfortunately the realization is perhaps a little bit too late. Chemicals are being dumped into the environment, in effect altering the Earth's biology. The result has been a demasculinizing and feminizing of plants and animals. For instance, sperm of flowers, pollen, and trees have rapidly and alarmingly become sterile. Younger men's sperm is more impaired than older men. Impaired spermatogenesis. There has been a dramatic drop in human sperm production. Grade A sperm move about 8 centimeters per hour, and this type of sperm has been measured and shown dramatically to have dropped in all men. Most men show the count of abnormal sperm to have increased by a noticeable percentage in the last 25 years. Body tissue metabolizes these strange endocrine disruptors from strange chemicals uniquely. Some tissues accumulate and concentrate toxin. The effect comes about through chemical affinity. Some of these chemicals have a lifetime residence within body tissue. Many of these compounds activate gene expression, which acts like a natural hormone. In extremely low concentrations, chemicals like DDT, PCB, and TCB can have made breast and prostate cancer cells grow out of control. With a high-fat diet and with solvent contamination, neoplastic cells can have grown unchecked. Chemicals can interfere with the body's ability to break down natural, similar compounds that would have ordinarily been produced within the body. Fat deposit can have become a hazardous waste dump where toxic chemicals are stored. Environmental estrogen can possibly account for 20% of the neoplastic cells, and avoidance of exposure could save 36,000 U.S. women per year from breast cancer alone. Exposure to chemical estrogen and androgen cocktails in the womb permanently can alter the way reproductive organs and genitalia form. Small increases of hormonal exposures before birth can result in doubling hormone receptors and permanently increasing sensitivity of the body to endogenous, made within the body, hormones. As an embryo, there is a constant changing of hormones that affect development. Chemical disrupting hormone exposure during development can critically inhibit tissue from responding appropriately. PCBs and a close chemical relative, furans, have contaminated oils consumed. PCBs have contaminated most groundwaters. The exposure is equivalent to the effect of having smoked reconstituted, sugar-fermented tobacco during pregnancy, and how that could have impacted the baby's health. Hormonal disrupting chemicals can contribute to neurological and behavioral development. Strange human-made chemicals exist now that were never found on the earth. Those toxic strange chemicals are close to chemicals that are naturally produced. Naturally produced chemicals can be broken down for the most part, yet human-made chemicals are uneasily broken down. The result is this effect of mimicking a biological chemical that blocks receptor sites, having other than excellent cell response, and in some cases having caused cell necrosis. Final note on phthalates. In writing this chapter, the goal might be agreed upon to avoid contact and exposure to plastics in our environment as much as possible. This includes the areas of home, work, and recreation. In the classrooms and school playgrounds, we have seen extreme unsafe environments gone unchecked. We should never wish to present any health challenge to our children's future, yet we have totally ignored that possibility. Think of how many parents are unaware of toxicity, the toys their children are allowed to play with. If we seriously consider the impact of these strange xenoestrogens, would we put an immediate stop to this madness right now, in this very instant?